Hi, my name is Dr. Keith Radbill, and I am the medical director here at Renew Us. So we've made several videos, and my passion lately has been on the number 2 biggest killer in this country. Now, we all know that the number 1 most modifiable risk factor for our health is cigarette smoking. But what's number 2? Obesity. Obesity is a disease, and it's a disease which we are not treating, and we are not treating effectively, and we are failing. The whole world is failing, but especially this country. We have foods that are rich in carbohydrates, which we know it's pretty much the carbs that are causing us to gain weight. But at the same time, this has been a real breakthrough time as far as treatment for obesity. We are learning through different addiction models that this is a disease. And when something is a disease, it's not so easy to say, just cut this out, lower your caloric intake, increase your exercise, and you'll be fine. We know that doesn't work. We know that there are programs that can help patients lose weight, but the problem is keeping it off long term. Why is it that anyone who loses weight in a weight loss program almost always, 90% gain it back within a year? Why is that? Because it's a disease. And it's a disease that we need to treat, and we need to treat medically. Now, I remember when I was a kid, there was a doctor in the neighborhood nearby. One of my friends worked there, and he was the diet doctor. And people would pay cash. They'd go in, and he would give them diet medication. Now, back then, they only had, pretty much one type of medication. But people would pay cash. Well, again, this is a disease just like high blood pressure, just like type 2 diabetes, just like anything else. You should be able to walk into your doctor's office and get treatment with FDA-approved medication for obesity, and you shouldn't have to pay cash out of your pocket. Well, that's the whole point of what we do at Renew Us. Renew Us is a wellness program where we look at all of you from head to toe. Again, it's not just obesity, but that happens to be my passion. And we have an arsenal of weapons and medications now at our disposal to treat this. In the old days, all we had was amphetamines. Phentermine, which we still use today and has been shown to be safe, but is not without possible side effects. Back in the 90s, they had a fen-phen phase, and a lot of people were concerned that one part of the fen-phen may have caused some heart problems, and a long-term study showed there was really no problems at all. But nowadays, we have new medicines. You don't always have to go with a stimulant. We have medications called GLP-1 agonists, and I love these medicines. Now, they're not new. They've been around for, maybe 10 years, and we've used them to treat type 2 diabetes. And how they work is really getting to the cause of obesity. What is the cause? Carbohydrates, right? Carbohydrates. So if we help our body to digest these carbohydrates, to not let us get these glucose spikes when we eat a meal rich in carbohydrates, and to suppress our appetite, that's basically how these medications work. And they're phenomenal because, like I said, they're not stimulants, they're not narcotic, they're not controlled, and you can be on them indefinitely. And even though they are type 2 diabetes medications, they won't cause low blood sugar. So a non-diabetic can take them. Now, a lot of people will say, well, isn't that dangerous to take a diabetes medicine? And the answer is no. They're actually relatively safe. And studies have shown that people who are on them, their heart health actually gets healthier. So we have that class of medicines. We have another medicine that should be out any day. And this medicine basically is not even considered a medication. It's considered a weight loss device. And it's completely safe. It's where you take these capsules and when you drink a bottle of water, they kind of expand in your stomach and make you feel full. It's FDA approved, and it should be out, we're told, in early 2021. So, my point is that we deserve to be treated properly. We deserve to be able to treat our patients, and for them not to have to go and pay cash out of their pockets to a weight loss clinic when obesity is a disease and your insurance will pay for your treatment. Now, that's not to say it's all a perfect world where I write a medication and the insurance covers it. Sometimes there's a lot of work. Sometimes you do have insurance companies that will fight you on this, but we do our best here. And you also need a program that is more than just prescribing the medicine. Going over your diet is important. What about metabolism? For years I've heard patients say to me, well, I have a really bad metabolism. My metabolism is slow. And, whether or not that was true, we could never really prove it, but now we can. We actually do a test here. It's called a review, and it's spelled REEVUE. You breathe into this machine, and this machine will tell us how many calories you're burning in a 24-hour period. It'll then give us a weight loss zone and a weight maintenance zone. So we can give our patients a caloric goal to keep their calories under. It's really valuable, and I find that patients really tell me the truth when they say they have a poor metabolism, and we do this test, and it shows that they're only burning 2,000 calories a day, which would put their weight loss zone below 1,500 calories a day. I don't know about you, but if you're going to put me on 1,500 calories a day, I'm going to be starving. That's not possible, and it's not fair to people. And when we can document that to our patients subjectively, yes, it is not your fault. You have a metabolism issue. And a lot of our patients, what's the only way to increase your metabolism? Exercise is the only way. And in a perfect world, in all the journals I read, we should get our patients to be exercising more and eating perfect. But the real world is not so simple. Many of our patients have chronic pain, bad backs, use walkers. How can they exercise? It's really, really difficult. And that's where our program, like I said, looks at the entire person. We're going to take all of these aspects into account. And I really want to tackle this problem of obesity and really tackle it head on. There is more to this program than just that. There's so much more. I could talk for hours. A lot of it, as we get older, things change. Our metabolism changes. Our hormones change, and that affects our metabolism. So we also, when we're looking at the hormones, as we age, aging is directly related to our drop in our hormonal level. And when we monitor this in our patients, and sometimes and appropriately treat it the right way, combine the hormones with the medication, with the exercise, with the diet, with other testing, we can really get our patients as healthy as possible. I mean, my ultimate goal really is to prevent cardiovascular disease. And I love it when I've had a patient for a year, 12 months after being in the program, and their cholesterol is improved, and their hemoglobin A1C, which is a blood sugar test that is a really good reflection of overall health when that numbers come down. We also look at inflammation. There's a lot in medicine. We look at other countries, like why are we as the United States so woefully behind Europe and Asia, Japan and Australia with regards to life expectancy? We have such a great healthcare system here, but we can't prevent heart disease. We're among the bottom as far as developed countries, and the reason is our diet and the obesity crisis. But there's more to it than that. Inflammation, in Japan, where they live to be into their upper 80s, they have a diet that's rich in fish and antioxidants. And we also hear about the Mediterranean diet, which is the best diet in the world. And why is it so good? It's good because it's rich in antioxidants. And that term antioxidant means anti-inflammatory. Our car, we wax the paint to prevent oxidation. Oxidation does the same to our bodies. It irritates blood vessels, which causes plaque to accumulate. There are some theories that it doesn't really matter what your cholesterol is. If you don't have inflammation, the plaque won't stick to the lining of the wall. So we're going to look at these inflammatory markers, which we can measure in blood tests, simple blood tests, a homocysteine, an HSCRP, LPPLA2, myeloperoxidase. These are all blood tests that are easily available at any lab. And when we follow these numbers, we see them get better when we implement the treatment that we do here. It may even involve vitamins too. You know, people ask me all the time about, well, I take a multivitamin. I say, well, you're wasting your money. You know, what is a multivitamin? Well, it's giving you the minimum daily requirement of A, B, C, D, E, go through everything, zinc, you know, you name it. Well, if you have a normal diet, or if you have an okay diet, you're going to get 100% of all of these. But the question is, which ones do you need a little bit more of, right? It may be B12. It may be metabolized B12, or what we call, you know, B12 is known as cyanocobalamin. But methylcobalamin is really the activated form of B12. So, you know, I know this is a lot of maybe mumbo jumbo, but there's a strong genetic effect on how our body metabolizes certain vitamins like B12 and folic acid. You could take all the B12 and folic acid in the world, and if you're deficient at activating those two vitamins, it's worthless. So we're able to see that in your blood tests, and we're able to see objectively. I mean, think about this. A blood test that shows inflammatory markers elevated, and then we've made changes. And then 12 months later, those numbers come down, and they continue to come down. Our patients are getting healthier. They're getting older, and they're getting healthier. That's every doctor's dream. So really, when we can incorporate a total program like this, I just think it's invaluable, and do it through insurance, because it's all about health. It's all about reducing heart disease. It's all about reducing stroke, reducing type 2 diabetes, pre-diabetes, high cholesterol, and do this in the healthiest and best way possible by looking at the entirety of the patient, not just your blood pressure. Here's your blood pressure medicine. Your cholesterol. Here's your cholesterol medicine. No, let's look at everything, and let's get you as healthy as possible. So I really would love for you to come down here. I love to meet with anyone. I love to talk with anyone. This is my passion. So I'm happy to talk with anybody at any time on the phone. If anyone has questions, please just give us a call anytime. Our number here is 888-210-3054, or you can visit us at renewus.com.